October is Breast Cancer Awareness Month. Most of us know someone who has been touched by breast cancer. In fact, some of you watching right now might have questions, but you're not sure exactly where to turn. Well, today we are here to help you. Joining us today is Dr. Elizabeth DuPont with Watson Clinic, where she is Medical Director of Breast Health Services, as well as a board-certified breast surgeon. Thank you so much for being here, Dr. DuPont.
Absolutely great to be here.
And we really appreciate having you. You know, most of us, again, have heard that breast cancer is treatable if it's caught early, but screening is key. So tell us about some of the screening processes for people out there.
Screening is key, and we know that no more than 75% of the women in the United States that are eligible for screening get it. It's self-breast exam. It's knowing your breast. It's clinical breast exam. Somebody in a white coat doing a breast exam. That's what I mean by that. And it's your mammogram. Mammogram is very important to the screening process.
Now, a lot of us have heard some different dates in terms of times of when women should get mammograms, at what age they should begin getting mammograms. So if you could just sort this out for us, what should we know? When should mammograms begin?
Mammograms should begin when you're 40, annually at the age of 40. And honestly, don't stop. If you're 89 and playing golf, get your mammogram. Now, if you have a family history of somebody, a sister, a daughter, that got diagnosed early, you need to have your mammogram 10 years younger than they got diagnosed. So if your mom was 40 at diagnosis, you need to start at 30 with your screening.
Wow.
Yeah.
Now, in terms of mammograms, though, not all mammograms are created equal, right?
That is exactly right. We made a big leap when we went from film or analog mammograms up to 2D mammograms. But now there's technology that's made a bigger leap. It's 3D mammography. So it's the equivalent of a chest x-ray, or rather a CT scan for your breast. It's very important. The other thing that is very important is who is reading your mammogram, because while not all equipment is created equally and you need to be at a certified center, but not all readers are the same. The breast-specific mammographers do a much better job overall, statistics say, than just a regular radiologist.
Now, you mentioned that family history plays a big role in who gets breast cancer and who doesn't. A lot of us can't do anything about that, but is there anything else that we can do that will lessen our risk of getting breast cancer?
Absolutely. It is a disease of being female and getting older. Nothing you can do about that. But what we can do is take care of lifestyle modifications. We know that our statistics for breast cancer have gone up as our activity and our sedentary lifestyle has increased. The activity's gone down, rates of cancer have gone up. So if you exercise, you will help yourself decrease your risk of breast cancer.
It's as simple as that. You said a brisk walk an hour or so a week is all it takes.
Exactly. An hour and a half to 2.5 hours a week of brisk walking will reduce your risk of breast cancer by 18%.
Wow. That's a huge.
It is. It's something you can do.
Yeah.
It's in your own body.
Yeah. Amazing. If there's somebody out there right now, you said younger women, 20s and 30s, should be doing breast self-exams. If there's somebody out there right now who's done an exam and feels a lump, what is the first thing that they should do?
Don't panic. Think calmly. Don't panic. Pick up the phone and call your provider, your healthcare provider. Get an appointment to see them, get a clinical breast exam, and get some imaging studies. Proceed in a logical fashion. Don't go jumping off the cliff, because many of these lumps are okay and nothing. It really is true that most things that are found by women are not breast cancer.
Fantastic. Thank you for the advice, Dr. DuPont. Always good to see you.
Great to be here.
You can follow Positively Tampa Bay on Facebook with all of this week's segments and stories from behind the scenes. Stay with us. We will be right back.
At ABC Action News, domestic violence awareness is a year-round commitment. We include the statewide domestic violence hotline in our newscasts, on our website, even in social media. Even here, behind the scenes, we share that hotline number with our employees. Why? Because we know that hotline works. If you or someone you know may be a victim of domestic violence or dating violence, call 1-800-500-1119. No judgment.